The 2020 Minority Health Film Festival offers a diverse variety of films and events that we just wouldn't be able to offer in the in-person cinema experience. But I think what really makes it unique is the focus not only on public health issues, but the issues that really concern communities of color. If you're looking for a reason to engage or to try it out, this is the perfect time. Just go to mkefilm.org/MHFF.
Good evening and welcome to a session on systemic racism, a public health issue. We are going to be joined this evening by an esteemed panel of experts from around the country who will be talking to us about this issue of systemic racism, as well as, and what does it mean for that to be called a public health issue. Recently, there was a discussion about this topic in Congress when Representative Ayanna Pressley, Barbara Lee, and Elizabeth Warren submitted a bill on September 3rd saying anti-racism in the Public Health Act, where they identify systemic racism as a public health crisis. We live in the city of Milwaukee, where income, housing, and incarceration rates are at a national and all-time segregated and disparate level. And we also are we were the first city in the country in May of 2019 to declare public health as racism as a public health issue. We'll be joined tonight by a panel that I will now introduce to you, starting with Councilman Blaine Griffin, who is a City of Cleveland council member. He serves as the chairman of the City Council's Health and Human Services Committee. He's also someone who is a part of a number of other committees, that being development, planning and sustainability, finance, workforce, community benefits, and operations. He lives and works in a community that's very much diverse and full of other, and also very much an example of how you can work together and live together. And he's also had legislation that recognizes racism as a crisis that damages public health. And I want to welcome you, Councilman Griffin, tonight to the panel. We also have Director Jeff Roman, who serves as Executive Director of Milwaukee's Office of African American Affairs. Mr. Roman, Jeff, is a Milwaukee native who has extensive experience mobilizing and supporting equity-based and community-centered programs, policy advocacy, and collective impact initiatives. He has a long track record of working with grassroots philanthropy, nonprofits, and the public health sector, as well as diverse groups of Milwaukee residents. Welcome, Jeff, to the panel tonight. We also have Madam Chairwoman Marcella Nicholson. I'm having a hard time talking this evening. I apologize. She's the chairwoman of the Milwaukee County Board of Directors and the first Black and Latina woman elected as the chairperson of the Milwaukee County Board of Directors. Born and raised in Milwaukee, she worked to provide opportunities that were given to her as a young woman growing up in the zip code of 53206. She is a proud product of Milwaukee Public Schools and an honors graduate of the University of Wisconsin-Milwaukee, a proud Panther who I'm very happy to see on the panel. And has done a number of things with the whole idea of looking at racism as a public health issue, and welcome to the panel tonight. We are also joined by Lillian Payne, who is the Milwaukee Health Department Chief of Staff. She's a Milwaukee native and another Panther graduate. She serves as Chief of Staff at the City of Milwaukee's Health Department and has worked with the Commissioner to apply Milwaukee's resolution of racism as a public health issue as they respond to COVID-19. She's been very involved with the whole idea of Milwaukee's County Declaration of Racism as a public health crisis, and was also an award recipient for her work in that from the Wisconsin Department of Public Health. And last but not least is Dr. Regina Davis Moss, who is a Health Policy and Practice Associate Executive Director at the American Public Health Association. She is someone who has more than 15 years of experience managing national health promotion and disease prevention initiatives, addressing areas such as reproductive health, healthy aging, obesity prevention, health policy, and sustained capacity in public health. I want to thank all of you for joining us tonight, and I apologize for either saying your name wrong or stumbling over all your wonderful accomplishments. It's been a long day on Zoom, so I apologize for that. One of the things I want to do before I get into the questions is I was thinking about preparing for this panel, The one thing that that came across was James Baldwin quote. I'm a gigantic fan of James Baldwin. And when I think about the whole idea of systemic racism and who is perpetuating this idea of racism, one thing he says was, "I can't believe what you say because I see what you do." And often I think about people saying they're trying to make life better for those who are Black and brown. I often see liberals making various comments about how they feel about people's well-being, but I often don't see action behind what's being done to make that work. And I really want to engage in the conversation about that as well. And before I continue, I see that we've been joined by Dr. Bellamy. I hope I said your name correct, Wes. He is the chairperson, if I can get correctly. Let me start here. He's the author and former vice mayor of Charlottesville. He's the author of When White Supremacy Knocks Fight Back, How White People Can Use Their Privilege and How Black People Can Use Their Power. He's also currently the political science department chairman at Virginia State University. And I saw him on the Breakfast Club talking about his party, our Black Party, a political platform used on advancing the needs of Black people. Welcome, Dr. Bellamy, to the panel. I thought it would be important if someone would be willing to define for our audience so they have an idea or a common idea of what does the whole idea of public health mean? Like, how are we thinking about public health? And what is systemic racism from one of you who will be willing to talk about that? Just to define, so we have a definition, a working definition that everyone can focus on for the evening. Should I call on somebody or should we just go? Someone's gonna volunteer. So why don't we start with Regina?
Okay, so yes,
Okay.
first of all, it's great to be here. Why don't I start with health? So the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So basically what that's really underscoring is that health is not just, it's this whole notion of you are from the physical and the social aspect completely healthy, and it's just not sick. Now, public health goes a little bit further outside of that. So we're looking at health, but we're looking at it from a population perspective. And we're also concerned about societal effort to improve health, prevent disease, and prolong life. So just think about it when you go to the doctor, that's focused more on your individual health. Public health is focused more on groups, populations, races, particular genders, and a number of ways that we determine a group. Why this is so important to us as a profession is because we know, and we have known for a very long time, that racism is a driving force behind some of the things in our society that determine health. So a lot of people don't realize that going to the doctor is only a small percentage of what impacts your health. Where you live, where you're educated, or your access to quality education, your access to a safe neighborhood or a safe housing, your access to a job where you can earn a living wage will have an impact on your health. And I will yield to some of my other panel members if they want to add.
Thank you. That was very helpful. Thank you very much. Is it okay if I call you Regina, or would you prefer Dr.?
Absolutely, absolutely.
Okay. Wes, could you? I know you were there. I was wondering if you could kind of give us a definition of what your platform that I heard about on the Charlemagne show, the Breakfast Club. Could you talk about systemic racism? How do you define that?
Yeah, first and foremost, thank you all so much for having me here. I really appreciate it. Great to see all my folks in Milwaukee. Special love to my sister, Chairwoman Nicholson. We go way back for a while, part of the Young Elected Officials Network. So much love to all of you. And thanks for all the work you all are doing. When I think about systemic racism, I don't think it's something that can be defined in one specific definition, because you have both covert and overt racism. And as we talk about in the new book, When White Supremacy Knocks Fight Back, we've seen white people specifically, and even some Black people, be participants in white supremacy and not even know it. They do so in a subconscious manner with the things in which they say, the things in which they inadvertently do, quote unquote, or the things in which and how they carry themselves. When we look at the overt forms of racism, we all know about that. What we've seen in Charlottesville, situations like the white supremacists coming down and trying to take over our city, or we see things on television like the Klan. But when we see something like, and some individuals may call this controversial, but when we see something like this young man who's 17 years old, drive across state lines and then go and shoot someone and murder individuals. There's no other way to define that other than white supremacy, and that is the overt kind. However, for some, they scale it in terms of using frames that make it covert, because they say, well, he was just there to protect property. He was just there to do X, Y, and Z. And we have to be very conscious about how those things are played out within our communities and then how they seep into the minds of our people. It's very easy to look at a shooting, but what about when we're in our education systems in our schools and these white teachers refuse to teach Black history, or they have no knowledge about Black history, or they're trying to teach Black history without any baseline? That's a form of white supremacy. When we have police institutions who refuse to say that they have a systemic issue revolving around racism in their police departments, while for some of us that may seem overt, for many others it's covert, and they don't see or understand why the issue is there. When we look at minority contract spending within all of our municipalities, there's a lot of systemic and covered up racism there. So I think we have to take all of that into account, and those are things we're trying to address through our Black Party. So please join us.
Thank you very much for that. Lillian, good to see you this evening. You were very instrumental in along with Madam Chairwoman Nicholson, around the whole idea of seeing Milwaukee declaring racism as a public health issue. In your new position as Chief of Staff, what are some of the things, how are you looking at this as a public health issue in Milwaukee?
Yeah, just doing a sound check. Can you hear me?
Oh, you sound wonderful.
Awesome.
Yes.
So I'd like to go back in time for a little bit. Between the years of 2017 and 2019, I was the at-large representative for the Wisconsin Public Health Association. The Wisconsin Public Health Association essentially created the blueprint that Milwaukee County and the city have implemented. You know, they rectified it, made it their own. And I just want to add to that conversation about defining racism. I think racism is a social system with multiple dimensions. And this is something, through a collective effort, through my visionary leadership as the at-large director, that we created through a consensus process. So it was referenced earlier by a couple of the panelists here that individual racism is internalized or interpersonal. Systemic racism is institutional or structural and is a system of structuring opportunity and assigning value based on social interpretation of how one looks. And that unfairly disadvantages some individuals and communities and unfairly advantages other individuals and communities. And as Dr. Kamar Jones says, saps the strength of the whole society through the waste of human resources. A point of contention for us within this membership-based organization, that is the largest membership-based organization for public health in the state of Wisconsin, was the word crisis. So there is no epidemiological definition of crisis. The health impact of racism clearly rises to the definition proposed by, again, who we agreed upon through a consensus process, Gala. So the scientist named Gala. The problem must affect numbers of people in order to be a crisis, and it must require the adoption of large-scale solutions, which I believe Milwaukee County as well as the city has done so. For the health department in particular, the Milwaukee Common Council recognized racism as a public health crisis in July of 2019. The Public Health Association declared that in 2018. So the city's ordinance represents a commitment to dismantling racism and the implementation of strategies to reduce the impact of racism as a public health crisis. And during this COVID outbreak pandemic, it has been a guiding light for us to be able to talk candidly about how it is negatively impacted Black and Brown communities, and also informed how we did our targeted outreach and creation of strategies.
Thank you so much for that. One of the things I want to recognize is that Milwaukee was the first city to give us some race statistics on the issue of COVID, which was very helpful. And unfortunately, we were #1 in the country for what we saw at the time, and as it was played out in the Washington Post. But I think that was very much proactive and very much a reality we don't always get, is how does race play into these various traumatic pandemics that we're going through, this one we're going through right now. So thank you for the work you're doing. I want to go to Blaine and ask you, Blaine, how is Cleveland dealing with this, and how are you seeing this as a public health issue in Cleveland?
Well, thank you so much for allowing me to be a part of this panel. I have to say that I want to commend Milwaukee because a lot of the inspiration of what we did in Cleveland was because of what was done in Milwaukee City and Milwaukee County. So it's truly an honor to be on this call with all of you esteemed leaders. In Cleveland, we were making incremental change. We were doing things like decriminalizing marijuana possession, because African Americans were 8 times more likely than their white counterparts to get a charge for low-level marijuana possession. We were making changes because we required a certification in order to make sure that your home is lead safe, because so many children were being exposed to lead. We were dealing with infant mortality and really trying to deal with trauma in our rec centers and all of these different things. But as we were dealing with these things one by one, not to even mention the criminal justice center system, where names like Tamir Rice and Melissa Williams and Timothy Russell, who were victims of police violence. We were doing piecemeal things. We were doing reform. We put a 21st century reform effort in place, but we weren't looking at this comprehensively. So we saw what Milwaukee was doing, and we said these are things that we could do to actually measure our success. Because at the end of the day, people want to touch, feel, and see change. Most people, when we introduced this, said, "Okay, what does that really mean?" And I believe that Ms. Payne really articulated it well. That we have talked about this conversation and had this conversation for a long time, but now people want to see actionable steps. So, in addition to looking at our government system, we know that there's been discrimination in housing lending and other areas, which is redlining has contributed to a lot of this. So we want to look at some of our private systems and banks and philanthropic organizations, as well as looking at an inward-facing moment that we're doing as well. So the city of Cleveland is really, just like Milwaukee, we have a lot that we can learn from each other because we're very similar. A report just came out to show our poverty statistics. But what sticks out the most to me is that I serve a neighborhood that has the lowest life expectancy in Woodland Hills in the city of Cleveland, that has a 20-year difference in life expectancy from its suburban peers. Those kind of statistics are unacceptable to me. And that's the reason why we passed this ordinance. We passed it unanimously. 17-0 on Cleveland City Council. And now we're in the process of working with external partners like the Urban League, YWCA, United Way, as well as NAACP and First Year Cleveland, which deals with infant mortality in our city, to really make measurable change and change that people can touch, feel, and see.
Thank you so much, Blaine. Madam Chairwoman, I'm going to say that for a second because I don't want to mess up that beautiful first name. So I'm going to say Madam Chairwoman. You had posed a bill for increasing the living wage. And how does that relate to the whole idea of public health and dealing with issues of racism?
Yeah, absolutely. So it's hand in hand. And I just want to throw out some statistics specifically to Wisconsin and why it was important, and I think essential, that Milwaukee County was the first in the nation to declare this a public health crisis. I'm going to first start off by uplifting my sister, Ms. Lillian Payne. She did create the blueprint that allowed us to do this work. So we could not have done this without her. And I think it's important to uplift Black women whenever we can. As politicians, we're often in the front, but you don't see the community that's behind us that helps us to guide our work. So thank you, Lillian. So for us, Wisconsin is named the worst place to raise a Black child. 70% of Wisconsin's Black population lives in Milwaukee County. Milwaukee County ranks 72 out of 72 counties in terms of health of our residents. Created a mission for Milwaukee County to make Milwaukee County the healthiest county in the state by achieving racial equity. How poverty plays a hand in this is because poverty permeates our Black and brown communities. Without the ability to take care of your family, that leads to more crime. It leads to educational disparities, and it leads to health disparities for various reasons. The inability to afford healthcare, the ability to even go see a doctor because you're working 2 and 3 jobs to make ends meet. So when I look at the issue of wages, for me, that's attacking the issue at the root. How do we give people the tools and the resources that they need in their communities to thrive and to be successful and to grow within their communities, and that's by raising wages. We know this is a fight. The Fight for 15 was founded in Wisconsin, and it has nationally. We know that this is a national conversation, but so many people push back on this issue, including people of color. It's really important to recognize that poverty goes hand in hand with our health outcomes, and it's really important that we address both at the same time.
Thank you so much. Now, Jeff, I know you've been very involved in uplifting Black men in a lot of your work, and now that you're in charge of the African American office that was created about 2 years ago, what are some of your plans in your new role as director in attacking this? How are you dealing with this as a public health crisis, and what are some of your plans that you have thought about?
Oh, right. Well, thank you for the opportunity to be here, and hey, hello, my colleagues and coworkers from across the city and county and state and other parts of the country. I think a part of the role that I have the honor and the privilege of taking and the burden of taking on as the county has become was the first to declare public health, and many of the jurisdictions that are part of our county and around our region are following suit, is to help Milwaukee County be the driver of this work moving forward. And so when we talk about this racism being a public health crisis, I think a part of our role, the Office on African American Affairs, and the work of Milwaukee County is to help people understand what that means and break that down for folks, and to help bring awareness and understanding that this country has a history and legacy of race-based power, oppression, and bias that frames superiority of racial groups over others. And that perpetuates a system of behaviors and practice and policies that impact health and quality of life outcomes for all people of color. That system is pervasive and it's structural, it's institutional, it's systematic and systemic. And we can have a conversation about what those two words mean and the variation between those, but it's also interpersonal and intrapersonal. It's inside too, and, because it's the context and the framing of who we are as America. And that's the context that we live in, and that impacts our health, and it impacts our safety, and it impacts the wellness of all people. And so helping people understand that understanding first, so people understand why we take the stance that we're taking and making that stance, and the implications that has, and the leverage that we have as a county to be able to address the things that impact, but also supporting the jurisdictions, and the cities and our elected officials and community residents and all the sectors and partners that we need to work with to go along this journey with us. And so our understanding of public health also has to change, or people have to understand, I should say, not have to change, people have to really understand what public health actually means. Many people think that public health means health systems, hospitals, clinics, that kind of stuff. That's one part of our public health system. The public health, we are all a part of the public health system. It's not just the healthcare. It's not just the hospitals and the clinics. It's the nonprofits. It's the philanthropic sector. It's community. It's people on the ground, people on the block, raising issues and making noise. We're all a part of the public health mission, and we all play a role in helping to improve public health outcomes. We're all a part of that. And so helping people understand that and the interrelations of that work, the interrelation of health and racism and equity and all of that stuff, it all interlaces together and builds upon each other. And the Office on African American Affairs helps the people understand that, but then actually puts in place a roadmap and facilitates a process where we all come together and move that work jointly together.
Thank you so much. So Gina, I want to go back to you because I have a question regarding. I'm getting a little feedback from somebody.
I can hear you.
Okay. If you could talk to me a little bit, I remember when American Public Health came out with the proclamation that racism is a public health issue. That was major. It was like Kaepernick taking the knee because you were one of the first. And how did you assess that your company was ready for that? Because I'm always wondering, we want to move people forward, but many people in those companies, as much as what Wes said earlier, Black and white, are not ready to deal with it because they unfortunately have internalized their own racist thoughts because we're drinking the Kool-Aid all the time. But how did you get the APHA to be someone, or how did that work? Did you have any protests?
Oh, you're mute.
You're mute.
Okay, sorry about that.
Okay.
Can you hear me now? Great. That's a great question. That was a number of things that were working in our favor. Number one, we have a very dedicated and passionate staff that have known all along that this was an important issue. During the time, we had several elected presidents who had been championing this issue for a while, namely Dr. Kamara Phillips-Jones, Dr. Adewale Trotman, Dr. Linda Ray Murray, and several others along in that pipeline that were very instrumental in helping me and my staff to bring this issue before our board, our governing council, to say, hey, we need to step squarely into not just naming racism, but also using words like health equity. We were so focusing on words like health disparities, which really don't accurately reflect what the issue is. If I tell you I'm African American, right? So if I tell you I have diabetes, that doesn't explain to you why, or if that should even be the case. And so it was APHA is an organization that's 150 years old. So you're very correct in saying that we had a history that we had to reckon with. We had to own our part in how we may have contributed to some of these issues. But I'm really proud to say that we are redoubling our efforts. This work started about 10 years ago, but with everything that's happening, we're courageously stepping into this work. And I wish I could say we were the first to declare it as a public health crisis. We certainly were calling for public health individuals to name racism, but we had a lot of our state and local public health associations that declared it as a crisis, and looking forward to talking about what that means.
Okay. You know, when I was looking at the literature for a talk I had given, the APHA came up in Harvard. I think it was the Harvard School of Public Health was the other group that I tended to see as one of the first. But I just thought it was phenomenal to hear that. And I said Lillian was giving us she was giving lots of smiles when you were talking about all the APHA work. And Lillian, did you want to respond? And then I want to go to Wes for something provocative you said after I talked to you, Lillian. But Lillian, what were you grinning at?
I was smiling because APHA, the American Public Health Association, is our mother organization for the Wisconsin Public Health Association. So that I grew up here in public health, premier grad, first school of public health in the state of Wisconsin. So the names that you listed, that's the hashtag say their names, my heroes and sheroes of public health. And I just want to thank you for that. Thank you for creating conditions so that I could come along and carry on the mantle. You can't do this work by yourself. And it's not about just one person, but it is important to recognize, like our chairwoman said, those that are taking a stance and taking calculated risk to bring attention to these issues.
Yes, and can I also call out, we're saying names, can I also call out Bill Jenkins, who was the father.
Yes. Yes.
Okay, great. Wes, you brought up a provocative statement about in line of the issue of race, and in listening to you talk about your party, it's called Our Black Party, that you say there's an issue of readiness for people to understand and hear from Black and white people. And I was wondering, what do you think are some of the barriers to Black people hearing about this issue of racism as a public health issue?
Well, I think for many of us, it's just difficult for us to process it all. Like, we understand what it looks like when we see it, but sometimes we don't understand the underlying and long-lasting effects and impact of it. I'm just absolutely elated to be on this call and hearing so much of the work, the phenomenal work that you all are doing across your state, specifically in those cities. But then I think, like, how do we get that information to translate to the everyday folks on the ground, like on the block, on the corner, the folks who are just working to keep food in their refrigerator. Like, I live in Charlottesville. I live in the hood. I live in one of the last Black neighborhoods in the city. We're a city that's only 19% Black. And I just think about, like, how my household operates, because my children, as I tell them all the time, they have a lot of privilege. It's very different from the people across the street. Across the street, they're focusing specifically on, they're not worried about, like, tomorrow's next month's election or November's election. They're worried about keeping food in their refrigerator. They're worried about how do we keep the lights on. They're worried about making sure that there's gas in the car so that they can get to work. They're severely impacted by COVID. So when we talk about how these issues of racism have impacted all of us, we have to figure out ways and mechanisms for us to be able to explain this in the most basic and simplest terms for our people, and then empower them to take their power to make change. So that's part of why we started our Black Party. We always said you can be an independent, you can be a Republican, you can be a Democrat, but before you're any of that, you're Black. And there's nothing wrong with Black people centering our own needs and centering our philosophical ideas to ensure that our people get what we need. And I think that's the next step for us as a whole. Like, yeah, Republicans aren't going to save us. Democrats aren't going to save us. Individuals who only come around and take a picture with us because they want to vote aren't going to save us. The work that's going to save us is us actually saving ourselves. I love what the brother Roman said, my sister chairwoman. Like, I love all of you all talking about the impact and the policies that you put forth to address these issues, specifically using data points. But now, again, how do we move that data into actual tangible action to bring our folks to a different light so that we can be empowered? Because I firmly believe that we have everything that we need within ourselves to not only save ourselves, but to continue to do the work to ensure that we get to the promised land. It's just about us collectively galvanizing to do it.
Well, Chairwoman will give me some stats. So I'm going to go to the Chairwoman to see if she wants to respond to some of the things we just heard from Wes. Nicholson, I can't hear you.
Okay, here I am. Yes, absolutely. I think it's an issue that we all just have to realize exists and be willing to put the work and work through the mess that we're undoubtedly going to occur, because when you're working towards real change, people get scared. We need to galvanize. We need to mobilize. We need not just Black people, white people. We need Asians, Hispanics, people of all colors to stand behind us. We look at the national conversation that's happening. George Floyd created a global conversation. Black Lives Matter became a hashtag that people in Russia and South Africa and South America and Europe, anywhere you can think of, we're sharing this hashtag. And it just shows the power of, if people come behind you, if people stand behind you, then you can achieve a goal. And that's just how we have to look at it in our communities. I think for so long, especially in Milwaukee, because so many people in our communities live in such disarray and in such chaos, even the thought of improvement of lives to other people seems like a threat to their own livelihoods. But if we can learn that we're all in this together, that if we can improve outcomes for people of color, then we can improve outcomes for so many other people. And I'm sorry, I feel like I'm rambling because there's so much I can say, but I think Wes really hit it on the head. I think there's not a lot that I can add to it other than we really need to work together. And yes, galvanize as a community, and we need our allies behind us as well.
Can I add to something that Chairwoman said really briefly? I'm sorry, Dr. B. Hey, I don't want us to skip over the point that Chairwoman Nicholson made when she said how scary it is. Like, that's something that I think a lot of us, and myself included, I often just skip that piece. Like, come on, we got to be strong. We're the strongest people. Look what our ancestors made it through and so forth. But if we're being candid, like, white supremacy has literally made it very disadvantageous for us to speak up and stand up for ourselves. These systems have made it okay, and we think that it's actually easier and it's the best thing for us to do, to just keep your head down and keep walking forward. Keep your head down and stay out the way. I talk to my homies all the time. It's the saying that we always say, yo, what's good with you? Man, I'm just trying to stay out the way. I'm like, nah, we're not trying to stay out the way. Like, we need to be standing in the way to make some noise so that we can get what we need to get. But a lot of us have been conditioned to not speak up because it can be something that takes away your livelihood. When you speak up and use your voice, you can become individuals just literally ostracize you, become blackballed. So that whole piece of taking back our power is something that we collectively have to do to remind our brothers and sisters and those who don't identify from all portions of our community that we have your back. Like, this is a mental health crisis. This is a physical health crisis. It's a spiritual health crisis. But collectively, we have your back. And the sooner we can get to that, I think the sooner we'll be able to see tangible results again.
I think always grounding this work in that the United States was built on white supremacy and capitalism, and that the change that we want to see and that we're working towards, because everyone has a lane, right?
Yes.
We may not see a lifetime. It's accepting that and also adding up the cost. What are you willing to give up? Are you willing to pass the mic to the side? Really about showing up in your full self after and while doing the work of unpacking internalized oppression and unpacking internalized dominance. So all of this.
Thank you.
Here for it.
Thank you. Blaine, what's going on with you in Cleveland around this whole idea of recognizing racism. But also, I want to add another caveat to it. I've heard so many white people say they just realized that they're white. They just realized during this Black Lives Matter movement or this whole George Floyd that they never think about the fact that they were white. They never thought about Black people having to go. That's a whole nother discussion. We need a whole nother hour on that one.
Yeah.
But it's
what
a
is
real thing.
and the currency of whiteness. Yeah.
Because I've heard a lot of people understanding or just now recognizing their whiteness or their white privilege. And I just saw on my internet just before this meeting, our current president is saying that he's going to start looking at how we teach history, because it should be a pro-American history that's being taught, not the use of 1619. So in your community, how are you hearing some of the same things? How are you dealing with this whole issue of Blackness being at the forefront and people having to deal with it in Cleveland?
Absolutely. I mean, I tell people all the time, and Dr. Bellamy actually stole what I was going to say, is that they're lying. I mean, they know privilege when they see it because they benefit from the systems that are in place. And I know that a lot of scholarly people are on this line today, but Robin Angelo, White Fragility, is a pretty good statement. And she kind of outlines the difference between bias and biases that we all have. Everybody has biases. Discrimination, how you act upon a person or a group of people by discriminating against them. But what our real target is are systems. And that's what people, I believe, are starting to wake up to. I know that people now are starting to say that, hey, we actually really do benefit from these systems that are in place. We actually do benefit from a criminal justice system that is less likely to charge a white male for marijuana possession than a Black male. We actually benefit from a system that provides better health care, as the public health expert, Dr. Moss, said, that is not just dealing with access to a doctor, but the root causes of the social determinants of health. We actually benefit from having stable housing, and now that we are starting to put systems on notice, and I hate to say this, but sometimes when you have the disruption of the system that we just witnessed, especially after the George Floyd case, and in our case, several events that happened in Cleveland, most recently, a shooting of a gentleman by the name of Desmond Franklin. Now these systems are starting to say, you know what? We better actually sit down and listen to people, because if we don't, it's going to hurt our bottom line. And as my sister said about capitalism, you want to scare corporate America, you scare their bottom line. You scare the fact that, this whole theory that our president, number 45, puts out, that, these cities are full of scary Black folks that are going to come to the suburban areas, is a false narrative. Because quite frankly, it's the people that are waking up in the suburbs to say, wait a minute, if this system has the power to oppress Black people, it's soon going to come to a neighborhood near us, just like the heroin epidemic did. So this is just as much about self-preservation as it is about trying to be helpful to another class of people, is guess what I'm saying.
Jeff, what do you see as some of the, what do you recognize as one of, and this is hard, this is probably a stupid question, but I apologize. What do you see as the most pressing issue for Black families in Milwaukee right now, in terms of dealing with this as a public health issue?
Jeff, you're muted.
Jeff, yeah.
The most pressing issue for Black families in Milwaukee? Generally, because there are different types of Black families, and class and all of that. But generally, I think a couple of things. I actually think a couple of things in this. One is Milwaukee's Black community is a very young Black community, and we are not a Detroit or a Philadelphia or Atlanta that have generations upon generations and legacy of activism and capacity and infrastructure in their Black communities. We're not those cities. We don't have that. And so when even though we're a large Black community, we are not as mature as some of our older, more established legacy Black communities that we see across our country. And because we don't have that maturity as a community, we lack the capacity, we lack the skill set, we lack the ability to organize ourselves and mobilize ourselves around the things that we know impact us, that are detrimental to us. And so there are issues of coming together, and a part of that are issues because of the system that we live in, racism, and the internal impact that racism has internally, but also in the communities. We don't trust ourselves, and we don't trust each other. And because we've been hurt, we hurt each other, and that for Milwaukee, I don't know about other cities, but that is an issue. That is a problem for Black families in particular in Milwaukee. One, we're a young Black in terms of time that we've been here as a community. We're young. We are one of the youngest in terms of age. We are one of the youngest Black communities in terms of median age for Black folk in the country as well. When you look at our African American population, and then because of that, we don't have the ability, or not that we don't know how to do it, or that we can't do it, but we have not been empowered and taken upon the power that we have, the determination to be able to do what we have to do as a community to overcome those barriers, to come together and to work together and to organize and address the issues that we have with ourselves around trust and supporting each other, to be able to do that like other communities. And I know they challenge, and I know there are challenges in Philly and even Chicago. Chicago got a lot of stuff going on, but you look at their Black community, they have infrastructure and they know how to support each other when it comes down to it. We're not those we're not that level of community yet. But I think for Milwaukee, for me, those are the type of challenges that I see are detrimental for Black folks in Milwaukee in particular. And when we figure it out, we can show the rest of the world and the rest of the country how to really do it.
That's literally the case with our community. Yeah, like we all have those same issues, specifically revolving around trust, revolving around people who are in positions of power, how we do it, what's the plan. But I think that just goes to show that Black folk aren't a monolithic group. So when we talk about how we address a lot of our issues, and I'm not saying you're doing this, Brother Jeff, because I think you're absolutely brilliant. I just mean in totality, we often talk about our issues and we say like they're deficits or they're detriment. But in fact, they're really part of our strengths, because it goes to show the diversity of our community, contrary to what the current individual running for president said when he said that Black folk aren't as diverse as the Latino community. In fact, we're very diverse. We have a lot of different thoughts about how we should do things. We have a lot of different thoughts in different ways and methods about how we need to become free. And that is okay. I think when we talk about the health of our people, that's another component of it, like understanding that there is no one way to address and defeat white supremacy. Because if there was, this would have been beat last year, last month, yesterday. This is a 400-year issue that's been taking place for generations. And in order for us to be able to defeat it, we're going to have to continue to band together. But we have to be a group of people who can fight it your way, his way, her way, those who don't identify as way, in a multitude of different ways, and come together in different capacities and even in disagreement to be able to address these issues. So I would just encourage you, brothers and sisters, to keep going. Because from what I'm hearing on this call, and then what I know how the spotlight has been on Wisconsin in the last kind of 60, 70 days, people have been very impressed with what you're doing. I know folks here in Virginia are. We've been saying, why can't we do what they're doing up there? So don't be coming on this call talking about what y'all ain't doing, because now I'm gonna be crazy.
Okay. We do a great.
Can I just piggyback
Sure.
on
Go ahead.
Roman's question? Because I think we hit on the general issues that our community face, but I just wanted to highlight that at this moment right now, the biggest issue facing our Black community is the coronavirus pandemic. The Office on Emergency Management did by creating that data that shows the racial breakdown of coronavirus cases. It showed that more than half of the state's cases were in Milwaukee, and a majority of the deaths were African American men and women. I want to give a short anecdotal story. So I have a colleague, represents a white community. She came up to me one day and said, "You need to get your people together. They're carrying the virus and they're spreading it around." She basically thought that Black people were more susceptible to the virus and were, responsible for spreading it. And I said, well, no, let me lay it out for you. It's mass incarceration. It's, defunding of education. It's poverty. It's lack of health care. It's the fact that people can't go and see a doctor on a regular basis. It's the fact that our essential workers are majority people of color, working on the front lines to make sure that you can go to the store and get your hair done when you want to protest. And so I really want to underscore here that what he did was it provides undisputable data that we can now use to inform our work as legislators to make sure that we can continue to impact the issue, because it's so important.
And can I
Regina, I want to have Regina talk. She's been quiet here, and I want to hear some of your national perspective on some of these comments as an APHA representative.
Sure, and I also wanted to, there was a couple of points I wanted to make, and so just following onto that. So it also highlighted the notion of this misallocation of resources, right? So if you overlaid those communities, you probably saw more testing centers in the more affluent areas, and you probably also saw more doctors' offices and a lot of other services surrounding those individuals so that they could be tested, have earlier intervention. You take any major city and you do this overlay. You look at where there's the highest number of positive cases versus the highest numbers of death, and it tells the story every time. So that's one of the things that I think has made it why we have been able to punctuate this notion of racism as a public health problem, because we're seeing it play out in real time. I also wanted to go back to the previous conversation about why we can't come together as a nation on this issue of racism, and that's because the majority of white people still view racism as an individual level problem. They really don't see it as a systematic, institutional issue. And there was an interesting study done in 2019 by Pew Research Center where they asked this question, and the vast majority of white people, I believe it was 70%, said racial discrimination is an individual level, whereas 40% said that of Blacks said it was institutional. So if we're not together there, then it really makes it difficult for us to intervene on this issue and to target the resources, and we don't necessarily we're fighting against the will. So we're fighting against what we know is there and having to make those convincing arguments. So now I would say that was data in 2019. It would be really interesting to see where those racial attitudes are now, given everything that's playing out, because I believe for the first time, white people are understanding what it's like to not be able to go to your doctor right away, to not get service just like that. So, let's be hopeful. And there's been some things that we've had to be creative around, things like telehealth, but those are going to be really helpful to servicing those vulnerable populations, and we have been trying to advocate for these things for a very long time. And so I'm trying to remain hopeful, because we have to, that we're moving in the right direction.
You raise a good point about the whole idea of meritocracy. Many people, we all are brought up to say, if you work hard, go to school, get your education, do what you're supposed to do, you'll be successful. And what's been played out so time and time again for Black and brown people, for Black people I know, they work really hard and they still don't get what they deserve. The data shows that a white high school dropout makes more money and has more wealth than a Black male college graduate. And it's just ridiculous, the wealth disparities that are out there. Not saying people shouldn't get education, but people don't want to believe that there are systemic issues, institutional benefits to people who are white that Black and brown people just don't get. And really, Black people don't get. Let's be honest here. Some brown people will get it, but Black people don't get it because we are just not seen as their equal. This is what white supremacy is all about. Lillian, you have a big job as chief of staff, and I want to give you all honor and praise with this whole idea that Milwaukee is now going to deal with racism as a public health issue, and you're the new chief of staff. What are some of your things you're thinking about moving forward and making Milwaukee the healthiest place to live?
That's a great question. I think I want to give recognition to our health commissioner, Dr. Jeanette Kwolek, who has been leading the health department since September of 2018. It is through her leadership and her modeling of how to handle a public health emergency that we as Wisconsin and Milwaukee are on the map with our COVID response. So pivoting, moving forward, or while during the pandemic, the health department has services that we have to provide to honor ordinances and laws. So we got the flu season's coming up, vaccinating clinics. We have the STI clinic. We have an obligation with our doula program that will be launching soon. These are things that were highlighted with the ordinance that the city of Milwaukee put forth back in 2019. A result of that was the BOM doula program, better outcomes for births. And within that, we had a reorg, and we're still implementing and operationalizing that reorg within a pandemic. just this summer, Common Council put forth request that all departments within the city have an anti-racism plan. So COVID has been a great magnifier of the structural and determinant issues that our residents of Milwaukee have been living in and breathing in and functioning in. And it is a large task. And with the resignation of our health commissioner, we have a strong leadership team that she put together. So it's not a chief of staff Lillian thing. It's a leadership team thing. And we have built the infrastructure. We have the foundation at least. So we're building as we're going.
And can I just say why that was so groundbreaking? Because I mean, we hear about things like a outbreak at a restaurant and bad food, and then, or even, you know, most recently these weather issues when they declare a crisis. So when you declare a crisis at that level, it not only acknowledges that it's an urgency and that requires the legislators, health officials, and all these others to step in, but it puts those critical resources behind. So we can analyze data, we can discuss the issues and how we can dismantle them. And it also causes us to hold some individuals accountable, because we're hearing a lot of states, you know, make these declarations, but really what we need is the action and the funding behind it. And they did such a great job with that.
Well, one of the things that happened, thank you. One of the things Wes, yes.
Dr. Payne.
Yes.
Oh, I just want to know, and Lillian brought it up, and thanks to Lillian. Lillian really did help support and really help at the state level, really usher this in. But I just want to, just for everybody to understand, when you talk about Milwaukee, we're not just talking about the city of Milwaukee and the work that's been happening around COVID-19 and health disparities. This is a collective work that's happening across all of Milwaukee County. And Milwaukee County and the city of Milwaukee and others across Milwaukee, and other municipalities are helping to lead the way. And so when Milwaukee City and Milwaukee County declared racism as a public health, it wasn't just the city, it was all of us together in doing that. And we are together leading the pack. And so I just want to know, when you hear Milwaukee, you're talking about both the city and the county and the work that we're doing jointly and together to move this work forward for the region and for the state.
Thank you for that clarification. Thank you.
There's the timeline.
Okay, there's the timeline. Okay. Wes, Charlottesville was very much a big part of this discussion around race a few years ago. And how has Charlottesville changed at all since since the incidents happened there around race? And I know you've been involved with getting rid of statues, around Confederate statues. How has things gotten better for you in that city?
You're on mute.
You're on mute.
Sorry about that. Yeah, so for us, it's been a long-term plan. While there's been a lot of talk and discussion about the statues, one of the things that I'm probably most proud of is that we passed something called the equity package, which is nearly $4.5 million in resources specifically to underserved communities. So $2.5 million for public housing redevelopment, $50,000 for anybody who lives in public housing or low-income housing to go get their GED for free, $50,000 for anyone who lives in those settings to be able to go to our local community college, a job position specifically for Black youth achievement, money to renovate parks and specific courses for local African-American history within our schools, and a wide variety of other items. Again, nearly $4 million. So we've been trying to address it with policy and then in resource allocation, because in our estimation, just my personal opinion, there can be no healing, there can be no reconciliation, there can be no kumbaya moments without a reallocation of resources. You show me you care about me by showing me what's in the budget. So in addition to that, shortly before I got off of council, I just finished up my term. Shortly before I got off, we wrote something called the Business Equity Fund. And the Business Equity Fund was essentially up to a $30,000 loan. It was $200,000 in a pot backed by the city, up to $30,000 for any Black-owned business to be able to either start their business or scale up their business. So we've seen a 27% uptick in Black-owned businesses in the city, as well as a 31% uptick in those who have access to local city contracting. So that's kind of how we've been able to address those issues. We've had our first Black female mayor, that's my sister, Nakaya Walker. We've had a Black woman police chief. But again, like a lot of these things that we're trying to address and undo these systemic issues, they aren't fixed overnight. They aren't fixed in a year or two. This is a long play. What I am also proud of, and I say this in closing, is that we've seen a lot of white people come to the front and understand not only their privilege, but sacrifice their bodies, their time, their talent, their resources. So, it's been definitely a transition. People are not afraid to have the conversation revolving around race. I remember literally being told that I'm single-handedly destroying our city, destroying our state. Like, we never had any issues before we started talking about the statues. And now to see not only these statues coming down across Virginia, across the country, and just the shift in the narrative and how people are having these conversations, it's been not only gratifying, but it's also, again, we understand, as Nipsey said, as the prophet Nipsey Hussle said, it's a marathon, and this marathon will continue.
Thank you. And what's when you were saying that, I was thinking about many times in my class when I'm teaching students, I'll use the word Black, and they get so nervous, and then they say to me, "Can I say that word too?" So it just goes to show you what color blindness has done to our country, where you say there's no color, and we're a country based on race. We created this social phenomena called race, but we don't want to talk about what this phenomenon is that we cause. Delane, what are some things you want to say in parting that Cleveland's doing that we should know about?
Well, Cleveland's doing a few things. We're still in the process. We're early in the process and really developing our infrastructure. But right now, what I'm more proud about in Cleveland is that I think that we have really gotten all of the major hospitals and institutions to really put infrastructure and resources behind it. We had the largest chamber of commerce in the United States of America. They've signed on to this. The 4 major hospitals, the second-ranked hospital, which is the Cleveland Clinic, which is in the ward that I serve, they're on board with this. So we're really getting a lot of support from the corporate community, as well as other places like the Cleveland Leadership Center and other places, to really try to make sure that we do an inward-facing moment and an inflection moment where we examine ourselves as city government. But we also, and I want to make sure that everybody knows that I think this is just as imperative, are also calling out and putting the private sector on notice too, that they need to make sure that there's equity and that they're not that we're dismantling their racist systems as well. So Cleveland is in the process. Really, we got a lot to learn from Milwaukee. I'll be honest with you, I've been in awe to be on part of this panel. I really want to reach out to Chairwoman Nicholson and Dr. Bellamy and Mr. Roman and everybody, Ms. Moss, Ms. Payne, because really we got a lot to learn. But at the end of the day, all I can tell you is that we want something that people can touch, feel, and see change. There's a sense of urgency right now. People don't want to be talked to death. And as Dr. Bellamy said, there's an old statement that says, you can't tell me you love me unless you put money behind it. Romance without finances.
Now we're going to go to that. Okay.
We want to make sure that we really get this right.
And
so
Chairwoman Nicholson, I know you have to go to another panel. Is there anything you want to say in parting?
Yeah, thank you. I would just say, I think Dr. Bellamy hit it right on the head. We're not going to solve racism in a day. We're not going to do it overnight. But I'm really proud of the strides Milwaukee County has made. Since declaring a year ago, we actually, 1 year from the date, I and my colleagues in the former administration, we introduced an ordinance that institutionalizes this work. We've trained every single Milwaukee County employee on racial equity. Every department leader, including elected officials who lead departments, have done this racial equity training. We have a strategic plan for the first time in 20 years. How the county has been working without a strategic plan, I don't know. But we have one now, and we're working to achieve those goals. We also have created a racial equity budget tool. So for the first time, departments have to submit a budget that looks at how it interacts with Black and Brown communities. And they have to justify the decisions that they make, not only within the community, but amongst their staff. And that's going to be made public, which provides that transparency that our residents deserve. And I'm just really proud of the new board that we have. They've been so committed and dedicated to this goal. And we've been working, tirelessly, especially during this pandemic, to impact racial equity. And then finally, I'll just say we elected for the first time a Black man as county executive, also the youngest at 33 years old. And out of the big 5 appointments that are made to lead departments, 3 of them are Black women. And that's really how we're going to start to dismantle these systems and really improve outcomes for people of color. So I just want to thank you all. It was a pleasure and an honor to be on this panel, and I really thank you for having me tonight.
Thank you so much for being here. Sorry you can't stay. We're going to close up in a second, but thank you so much for being here. I appreciate it. and enjoy your next session.
Thank you so
Jeff,
much.
Jeff, do you have anything you want to say in parting?
Well, Madam Supervisor actually took all of my talking points,
Okay.
but I do want to say that I think the focus on system change is real, and that's it. But the way that we understand systems is that they're fueled by behaviors and practices. Systems are fueled by behaviors and practice. So in order to change systems, we have to change the hearts and minds of the people that we have influence of. And that is the work that we are doing at Milwaukee County through our training, through our development of tools and resources and capacity building and support, not just for the departments that exist within our agency, our enterprise of Milwaukee County government, but for all the 19 municipalities that are part of Milwaukee, because we all, in order for us to become the healthiest county in the state, and do that by achieving racial equity, we all have to do this together. Every 19 municipality has to do their role and understand the role they have, so that Milwaukee is not the most segregated, is not the worst for this, or is not the worst for that across the country. And I just wanted to say, fear is a real thing. And racism doesn't just impact Black folk and other people of color. The ways that it impacts white folk, particularly the fear component, is real. And especially when we're talking about undoing racism, it's about giving up control and power. And people fear that more than anything. So understanding what racism really is and the depth of it is a part of what we need to do. And it is the work that Milwaukee County is doing. And the Office of African American Affairs is playing a real supportive and driving and facilitative role in doing that. And so thanks for giving us time to be able to share.
Thank you. Regina, what do you want to leave us with? And then I'll go to Lillian.
Sure. Well, first of all, thanks for having me. I always enjoy these conversations. It's very rich. I think I just want to, I always end, which is to make the case for why this is not just a humanistic sort of issue. This is an economic issue. This is an issue that impacts us from every aspect of our society, because the face of our nation is changing. We will soon be a majority minority population. So if we allow other populations to be sick, it will have an impact on us in tremendous ways. And it's a cost that we cannot afford to pay. I would also just say that it really requires that if we want to prevent death and disease, we have to address racism as a key driver of these issues.
Thank you. Thank you. And Lillian, closing us out tonight. Any final comments?
Yeah, thank you for having me on this panel. I was wearing multiple hats representing the city health department and WPHA. So I just want to nod back to WPHA. Our first goal was to assert that racism is a public health crisis that impacts our entire society. Our second step was to conduct an internal assessment of our policies and procedures. Those findings, that report is on our website. It points out that we aren't as open and welcoming of an organization as we've presented ourselves to be. And I use that plural terminology. That was my motivation for speaking up and taking that risk with being a disruptive innovator within that membership-based organization. So I just want to encourage folks to look at those, learn, and you can share about what isn't or hasn't worked for us, and how we've to work towards achieving that, being an anti-racist organization.
Well, thank you so much, all of you, for your wonderful comments. I want to give a special shout out to Dr. Bellamy, a frat brother who I'm happy to see is here. And also want to say thank you to Blaine, Jeff, Regina, and Lillian. It's always a pleasure to see everybody, and have a great evening. Keep doing your hard work. And thank you so much, everybody. It's been a wonderful conversation.
Thank you,
Take
Dr.
care. Thank you. Take care.
The 2020 Minority Health Film Festival offers a diverse variety of films and events that we just wouldn't be able to offer in the in-person cinema experience. But I think what really makes it unique is the focus not only on public health issues, but the issues that really concern communities of color. If you're looking for a reason to engage or to try it out, this is the perfect time. Just go to mkefilm.org/MHFF